Yes, it is on. All right. Well, as you know, we're all here to celebrate a very special occasion. For those who don't know me, I'm Dr. Lundeen. I'm the Chief for Primary Care. And today we're honoring Betty Holst. It's a very special occasion. It's her retirement. And I do want to say that all of us in this room have been fortunate to have had the privilege of working with Betty, or have been a patient with Betty, or both. Okay? Just want to give you a little bit of her background and just some of the really cool things that have gone on. Betty Holst joined the VA in August of 1980. And she's been with the outpatient clinic for the last 33 years, which is an awesome achievement. As a nurse practitioner, she has provided excellent health care with superb clinical skills for her veteran patients, and these patients number in the thousands. She has been such a wonderful role model for all of us in her daily interactions with the veterans. It really takes a very special person to commit to their jobs on a daily basis, even when the going gets tough. And Betty has been that person. There are many stories about the wonderful care she's provided to the veterans. One of our colleagues told me this story, and in regards to her father. It's just such a cool story. I want to pass it on. And this really epitomizes how Betty has taken care of her patients over all these years. This colleague's father was a patient of Betty's for 30 years. And during this time frame, she took great care of him. He ended up having Alzheimer's dementia. And when he went into the nursing home and he could no longer come to the VA, Betty would then call her mom, this colleague's mom, to check in and see how the wife was doing, but also see how her patient was doing. And when he passed away, then Betty called her mom and to express her sympathies and anything else they could do. That is truly an example of what we hope to achieve with all our patients. Thank you so much for doing that. Betty's also been a mentor to countless colleagues, and staff over the years. Many of them are still here. Many are across the country and other places. But just to give you an example, when I came to the VA in 2006, Betty was the person who graciously guided me through the labyrinth of our infamous medical record that we all know as CPRS. So she guided us through that. We'll ignore that. She answered numerous questions as I learned to navigate the healthcare system. And I would say that almost all the providers here have benefited similarly from Betty's expertise in health, and they could all tell similar stories like that. Betty, through your 33 years here, you have been a true professional and mentored countless colleagues and staff at the Sioux Falls VA. You have been a superb clinician and advocate for your patients. You are leaving a remarkable legacy of care and compassion that we all hope and aspire to achieve. We'll really all miss you. We'll deeply miss her here. But we hope that the years that lie ahead for you are filled with laughter and happiness with your family and friends. We wish you all the best in retirement. And as we say goodbye here, but it's not very well. Thank you for being here.
Well, good afternoon, everybody. My name is Sandra Horstman. I am the acting director for Sioux Falls VA Healthcare System. And I have to tell you, I'm extremely honored to be able to present the certificate to you. typically, when I do a retirement certificate, I get a couple minutes to talk to the retiree and find out what they're about and what they're going to be doing in their retirement and how they're going to be spending their hours. But as you can see by the turnout, I didn't get to get a word in edgewise, which is a true testament to the type of person that Betty is. I watched her as she interacted with you as you all came into the room. I've heard stories and comments as I was sitting around about the things she's done since she's been here. I hear about the friends that she's made who have moved on to other places who have already congratulated her on her retirement, and it speaks volumes. The measure of a person is in the friends that they have and the friends that they keep, and this turnout is just indicative of that. And I'm looking around, and we have young folks, and we have not so young folks, we have tenured people, and I understand a lot of you used to be medical center employees who have since retired, so I'm hoping that you're going to show her the ropes on what she's supposed to be doing when she retires. So, my personal congratulations to you, Betty, and if you'll come up for the formal presentation. So I'm going to be presenting this commendation to Betty, and it says, commendation. This certificate is awarded to Betty J. Holst, Certified Nurse Practitioner. It is a great pleasure to commend you for over 33 years of outstanding service in the federal government. You have been a patriot for our country as a nurse practitioner, patient-aligned care team, primary and specialty medicine service line with the Sioux Falls VA healthcare system. Your dedication and professionalism have played an important role in providing exceptional health care for our veterans. We appreciate your dedication to the veterans, their families, and your VA team members. Your efforts played an important role in bringing the hospital to a higher level of excellence. We extend our best wishes for your endeavors along with success, happiness, and good health in your retirement. Our lives have certainly been enriched by memories of our association with you, dated this 31st day of October. And this certificate doesn't even begin to express how much we appreciate her commitment and her service to our veterans and to this community. So thank you, Betty. I'm going to let Betty say a few words here in a second. I want to give anybody else an opportunity if they'd like to say something about Betty. Be nice. Or to Betty. Be nice. Anybody want to come up and have any words before we give Betty the mic? Wonderful.
I want to say a word about Betty. When I first came here, you know, I came here, I was out in Vegas, Las Vegas, and I come home and I had a letter from the VA that accepted me. And I come right up here the day and I got back from Vegas and I met Betty. And you know, I was out with a bunch of the old people. And they said, how in the heck did you get Betty as a doctor? I've been trying to get Betty as a doctor for ages and couldn't never do it. And yet you a new guy come in and got her?
Must have at the end,
I'm just going to take 1 minute here. I didn't prepare this, but when I think about Betty, I think back to her husband, Betty, and her entire family. And when I first started working here, I started working with the nursing home. It brings me to tears thinking about this. And it was Christmas Day, and in the nursing home with lots of patients there on Christmas Day, Dennis can identify with that. And I hear these beautiful, beautiful voices in the hallway. And it was Betty, her husband, some of her children, adopted children, and they were singing beautiful, beautiful Christmas carols. It was very, very emotional. Thank you, Betty.
What I would like to say to Betty, when I first came to the VA here, it was kind of hard. people getting used to me and me getting used to people. But I want to say to Betty, she was so nice. She took me into her office and she talked to me, and it was people like you, one of the people like you, that made me stay at the VA and to retire. And I want to say to you, stay like you are. Whatever you do, don't change. I love you.
Ton of people. Now I'm shaking like a leaf. I just want to say, I'd always gone to a male doctor before. So somebody told me, well, you're going to be going to a woman now. So I was up there, I don't know how many years ago, maybe 15 years ago, and there was a whole bunch of people lined up in the hallway there, maybe about 30 or 35 people. I pointed to Betty and I go, that's the lady I want. And boy, am I going to miss her. I love her to pieces. Thank you. Thank you, Betty.
Daddy, we are going to miss you so much. I just want to thank you for all the times when I was here in the hospital for 5.5 months that you came to visit me so many times and put smiles on my face. Thank you. We miss you.
As a fellow veteran, I'd like to thank you, and as an unemployed employee, retired, I want to thank you and enjoy your retirement. You deserve every minute of it.
Some of these people date way back.
Thank you, Betty. I started out with Betty as a nurse aide at Sioux Valley on Horse Island. And we are still wonderful friends. We go out to lunch once a year. And I value the friendship with her and Sioux Valley also. Thanks, Betty.
I have to take a minute too. Betty was my neighbor when I started about 15 years ago as a PA. And let me tell you, I have visited her office so many times, and she has been such a wonderful help and a role model. And as she leaves, the person whose footsteps I would like to fill. But I have a fun story. I think will make you laugh. I don't even remember how many years ago this was, actually. We decided we were going to do a medical education CME, and this was at Mayo Clinic. So her and I took off, and she was driving, and we had a great seminar, a great time together, learned a lot, and we're on our way back. And in South Dakota, we had kind of some crazy weather.
I think we'll stop
No.
now.
I think you'll all appreciate this story. Now, I am a little bit younger than her. And you know, most people think as you age, you get more cautious and careful. Well, I don't know if it's Lee she had to get home to. I'm not sure. But this woman drove like you would not believe. I mean, made me nervous. So I'm biting my nails. She gets me safely home. I live in Hartford. And she's going to go to leave. And she got a block away from my house, and she stopped at the stop sign and proceeded to turn, and it was slippery. She went right down in the ditch. So we got to have her at our house that night, and my kids still call her Grandma Betty. And I appreciate her as a role model so much.
Betty and Lee have impacted my life. You guys know. You guys. Thank you.
Okay, now it's my turn. Thank you, thank you, thank you. You are way too kind. I am very, very human and not always so nice. Just don't talk to Lee, okay? But I am humbled to have served our veterans who have preserved our freedoms for all these years, and it's just been my honor and pleasure to be able to serve our country and my Lord by serving you all at the VA this way. The students I've had, it's been my privilege to impact your lives in a very small way, and I pray that my example was a positive one for you. For you patients, I love you. I love you to pieces. That's what I used to tell the grandkids. And the older you are, the better, so it just makes you more special. But thanks, patients, for hanging in there with me. Some of us have aged together for the past 33 years. For some reason, I'm not as young as the day I walked in here. So I want to give some special recognition to people who've been there for me along the way. My husband, Lee, I'll have him stand up. He has allowed me to be away from home sometimes quite late in the evening. I don't see Patsy, but I was going to say thank you to Patsy Johnson, who was my nurse for many years, and she retired before me, and also to Dr. Whittle, and he did stop up. He was my supervising physician for most of the years that I was here, and he was a very great support to me, so thank you, Dr. Whittle and Patsy. Now, I've got some people that I'm going to ask to come forward, and Sharon is my sister. I'm going to have her come forward and put these pins on people. Sharon is my much, much naughtier sister than I. I tell people that, but until they really meet her, they don't know that. But she did I'm sure, that poster out there, so you can see her in action. But if you come up, Sharon, I'm going to put you to work. I've been bossing her for quite a few years because she is my much younger sister. All right, I want these people to come up, Barb Toller and Christy Staten. And then as long as you're up front here, just to not slow this down, Michelle Green. Michelle Green, Julie Kirst, and Dr. Dievik. If you guys will come up. Also, I will be meeting Julie Van Dam, so if she ran off, she needs to come back up. Somebody needs to get her here. She has a very, very special presentation. Okay. So, Barb, I remember Barb's first day on the job. Also, a couple more people to come up. Keep Amy Anderson close, and Michelle Abraham, you can come up, and Rolf. I want you to find me closer. Barb, I remember your first day on the job. She's just been a long time forever friend, and got the ribbon, and then you can read what I wrote to you there. But thank you for helping me through all the computer struggles, entering my education into TMS or whatever they all call that program that's changed throughout the years. I couldn't have done it without you. And Christy, she's a forever friend. There was a time that we even commuted together, and we drove together. She lived in Lenox for a while. We would commute together. Her kids were little then, and I remember they even had to check out the kittens in the playhouse, I think. I want to acknowledge my teamlet, and I don't know, I just was very, very blessed with having some great people to work with. Is Michelle Green up here? Somebody's getting her? Okay. Well, start with Julie Kirst. Julie has been my LPN that's worked on our team, so if you are my patient, you probably have seen her, and between Michelle and Julie, they really run a tight ship, and it's the nurses that make your team good, so You have to give these people credit. Michelle is coming up. Thank you, Michelle and Judy. They are tops. Why don't you give them a hand? And Margaret Dievig is my supervising physician now. Margaret, if you would come up. And they have these ribbons underneath. They're going to wear them with pride here. And also, if I could, I'd give everybody a ribbon or a flower here, and I can't do that, and it would take too long. So just a special thank you to Brandy Landis and Michelle Drent, and also Jeannie Brennan, who have been my nurses in the past. They kind of, changed around our teams and our pods and this kind of thing, and for a while they were my nurses and also did a very, very great job. So they were very supportive and very competent. Others on my team, Raja, Lydia, Jane, Jocelyn, Cassie, Lois, and Lynette. Thank you so much for helping me along my journey. I appreciate that. Now, I want to recognize some of my VA kids. And those are my daughters. And so if my daughters would step forward. I think you know who you are. But Amy Anderson, Michelle, Rolf, you are my son, in case you didn't know that. Have we gotten Julie back yet? I wonder if somebody can let her. Okay, we'll leave her to the end. All right. She's one of the older daughters, so she doesn't comply quite as good as the rest. Okay, I'll just let them get some ribbons on. And they say a very special daughter and son. And thank you, kids, you did well. Okay. Dan, okay. Let's give the kids a hand. Danielle. Danielle is one of my replacements. Another one will be starting, another nurse practitioner will be starting in January. But this is Danielle Schrader. And so I know that all of you were waiting to meet who was going to replace me, and she is a very competent person that will be stepping into my office. I do have a gift for her too. This is to put in the office, put on the wall, and then also she has a supply of stars. If you have been a patient and have gotten a star, you do have to work for that. So, they won't just be bestowed upon you because you have an appointment. Okay? You either have to quit smoking, quit drinking, lose weight, start walking.
Lower cholesterol.
Low cholesterol. And I have this also for the other one that will be starting in January. So they will be supplied, okay? Is Julie here yet? All right. We've been saving the best award. Sorry.
It's a dedicated worker.
Sorry. All
right, Julie, would you come here? Sharon, would you be so, we are giving special awards. I'm sorry you missed the rest, but this is yours. Will you put this on her? Julie, I am bestowing upon Julie my VA Mom Award. This will now be her title, and wear it with pride. No, I don't think you old. It's just that you're seasoned. Also, wear it with pride and dignity. It deserves a lot of respect. People will look to you for a lot of things, and you never know what those might be. This goes with it. So, okay, with that, that's all my presentations. I have completed this chapter in my life, and I look forward to and how I can serve my Maker in the future. I hope not to rust out, but to wear out. I don't know how that will happen, but I do hope to volunteer at least one day a week at Destiny Clinic, which is a clinic that Dr. Kidman runs on wherever it is, 28th in Minnesota, in the old Lewis building. So I'll do that one day a week or so. But I might wait and start until after Christmas. Not sure he knows that, but anyway, thank you to each of my VA family for your love and patience with me these last 33 years. To my patients, I love you and I care about you. That's why I'm leaving you in such great hands with Danielle and Lucinda. And blessings on each of you. Thank you for coming out to bring closure to this VA relationship. Thank you. Now you guys get something to eat, and I'll try to catch up on greeting those who I haven't greeted.
Stand back. Give her a hug again because I missed it. And then say hi to Belinda. Hi, Belinda. You were going to come.
We got here just about 10 after 1 or something like that.
Okay.
Well, anyway.
Oh, but you're not the doctor.
Yeah.
The green one's one of those. And the flowers, the white ones, make them look like I did not kill butterflies. And from the butterflies, like, so nobody died. Enjoy.
I'm glad I got to know you. I don't, do Yeah, he's too big.
Yes, we do. Go a long way. All right.
Let's see, Duck Dynasty. There you go.
I miss you guys. I miss my patients. But I sure don't miss the commanding general or the lieutenants.
I'm getting this on video, just so you know.
That's fine.
I like the Duck Dynasty outfit there.
There's nothing they could Duck Dynasty on. She doesn't know me. She's never met me. And she thinks I'm a Duck Dynasty guy. Am I? No. Mike or Jake?